Mr. Chairman. Senator Brown.
Thank you, Mr. Chairman. Thanks for how seriously you take this issue. I appreciate that. Ms. Therrett, thanks for your testimony. I wanted to raise an issue that VA employees have talked to me about and to my office about. The executive leadership teams at different medical centers apparently haven't worked collaboratively enough with local union leaders. I hope that you and folks at the VA Central Office remind staff in the field that a strong labor management relationship is essential to the effective and efficient operation of VA and that to improve the provision of care and benefits to veterans. And the unions, as you know, unions are an important component of that. Last year, Congress included several workforce provisions in the PACT Act as I travel the state and do roundtables with veterans in every part of the state. We can all envision the surge in care and the importance of scaling up hiring. So I know we've required VA to develop and implement a national rural recruitment and hiring plan. I think of the hospital in Ohio in Chillicothe. There's plenty of community-based outpatient clinics too that are in rural areas. So talk about, given the challenge, provide us with an update on that plan, if you would.
Senator Brown, thank you for that question. I want to reinforce our commitment to working with our labor partners. Our American Federation of Government Employees is in town this week having their semi-annual meeting. I know the Secretary is addressing them as well as other leaders within the department. We've also recently reached a memorandum of agreement with the National Federation of Federal Employees, continuing to find ways to improve hiring. So we are actively working with all of our labor partners. I know when the Secretary visits our facilities, he meets with them and asks them about their labor management forums, make sure that they are meeting and actively engaging. With respect to the PACT Act, we have implemented every provision except for 4 that are pending: the rural recruitment plan that I mentioned, the 1-year plan that we owe the Committee on Human Resources Positions, Recruitment and Retention, as well as the service contract buyout policy, which is being drafted and soon to be released. And then finally, we're also working on the final provision with the Office of Personnel Management around pay waiver authority. But every other authority is available to our workforce. We implemented them in waves. The first wave was removing the restrictions on hiring housekeeping aides. We know how essential those positions are to our medical centers. The second wave was ensuring that we are bringing in the next generation of talent to the VA. That was expediting hiring of college graduates, post-secondary students, and increasing limits on student loan repayment program. The third wave was around retention, removing some of the caps on bonuses and awards for our hardworking VA employees, as well as Ms. Bongiorni had mentioned, increasing those special contribution award limits so that we can really recognize the great work that's happening across the department. The fourth wave focused on our systems. As important as our people are, we don't want to lose good people to being frustrated with the systems that they have to use to perform their daily job. So with respect to our HR system, we improved some enhancements so that individuals can see where recruitment actions are in the process. We added some employee self-service capabilities so employees are able to use those systems to be able to do things more effectively and efficiently. And the last wave is implementing all of our pay authorities. Critical skills incentives are being processed. Recruitment, relocation, and retention incentives are being processed at the higher limits. Critical pay positions are being identified, as well as special salary rates implemented to keep up with the tight labor markets in competing with the private sector. So all of those provisions of the PACT Act are actively being rolled out. I know Ms. Bongiorni and her team are communicating to them to the field so that we are leveraging all of these authorities to ensure that we have staff at the levels that we need them. And I think the events that have been happening in VHA and VBA are demonstrating that. VHA, as I mentioned, has already brought on over 22,000 external hires in 5 months. That's record-breaking. The Veterans Benefits Administration has grown by 5% in bringing on over 2,000 new hires to process claims, and our retention rates are lower, are half of what they were a year ago. We were seeing 4% turnover. This year we're at about 2% turnover.
Retention rates are twice, not half.
Our retention rate is cut in half. Our retention rate is higher. Our turnover rate is cut in half.
Thank you. Thank you. And I just want to remind you that this is the most pro-worker, pro-labor administration probably in my lifetime as you work your way navigating each of these waves and as you implement the PACT Act and all that. One other question, Mr. Chairman. Local VA employees and medical center directors talk about the human resource modernization efforts that started in 2018. Some of us thought that was a wrong-headed move by the previous administration of the VA. We can put that aside for a moment, but it's clearly harder to hire people. There are other factors. I'm not putting it all in this. It takes longer to get folks. I'd never heard the word onboarded until you used it today. I get what that means. They leave for a job in the community facilities. I mentioned Chillicothe, but others, the more urban centers too, have been hosting local hiring fairs to get folks hired more quickly. Tell us why we can't just move back to a model where local HR professionals who know the facility's needs, who know the community's needs, why aren't they? Why don't we go back to their being directly responsible for hiring folks in these facilities?
Senator Brown, I'm going to ask Ms. Bongiorni to answer the question on the VHA modernization efforts.
Sure. Thank you for the question, Senator. I remember being here.
I'm sorry to interrupt, but from Senator Tester's question to both of you about how long it takes a doctor to be onboarded,
Sure.
And it just doesn't make sense to me that we're not driving this locally where they know the community's needs, they know the facility's needs, and they can make it much faster, I would think, than going up to Ann Arbor in my case, or even to Washington. Sorry, I interrupted. Go ahead.
Sure. If we look at our data on how time to hire has trended over time, right now our time to hire has returned to pre-pandemic levels. When we had special authorities, we were able to hire faster than we are able to hire right now, but that is not tied to the organizational structure of our human resources. In fact, the change that we made to move to shared services for human resources allowed us to hire the volumes we've been hiring, allowed us to rapidly change policies and practices tied to special hiring authorities during the pandemic, and allowed us to shift resources. The challenge we had with decentralized human resources is that smaller facilities, especially, had a challenge keeping HR staff on board, and then when they had vacancies, they had no one to hire. So moving to shared services allows us to shift across an entire region to facilitate the hiring process.
Senator Tillis.
Thank you, Mr. Chairman, and thank you both for being here. Mr. Chairman, I'd like unanimous consent to